Hello and good evening, dear viewers. Welcome to your daily program, Medical Talk, the program that brings you trusted medical knowledge. Now, although high cholesterol can often be managed successfully, leaving it untreated may increase the risk of serious cardiovascular diseases over time. Fortunately, healthy lifestyle choices together with appropriate medical treatment can significantly reduce these risks. Understanding how to manage cholesterol is an important step toward protecting long-term heart health. Now, to discuss this important topic, we are pleased to welcome with us again Dr. Badr Ali Almahdi, consultant cardiologist. Welcome, Dr. Badr.
Hi, it's a pleasure to be here again.
We are happy to have you again. Now, today's topic is mainly about patients or people, let's say people living with high cholesterol. Now, once a person is diagnosed with high cholesterol, what are the most important steps that they should take to reduce cardiovascular risks in the future?
They should see their doctor,
Yes.
whether it's the area's family physician or a specialized cardiologist or an internist, and they should be started on medication. Now, the choice of medication depends on how high their cholesterol is.
Yes.
And it depends also on their medical history. But usually we start off right off the bat with a statin.
Yes. And they need follow-up continuously.
They need to check their cholesterol within 3 months from the diagnosis.
Okay.
After taking the statins. And if their lipid profile is stable, they just do their lipid profile checked once every year.
Once every year.
Yes.
Now, if they are compliant with their lifestyle, that helps to do a checkup once a year also.
When you say lifestyle, you mean diet and exercise.
Yes.
Diet and exercise reduces cholesterol by a maximum of 15%. Okay, like if the patients reach their limits, if they push the envelope, it might reach up to 20%.
Okay.
But whether there is diet and exercise or not, they should take the medicine.
Yes, yes. Now, Dr. Badr, many patients worry about taking these cholesterol medications. Can they worry about these medications? Because, you know,
No.
they might think, is this necessary or not?
Of course. Now, thanks to modern medicine, people's lifespan has become longer.
Yes.
With these, you have to, if you have a chronic medical condition, and hyperlipidemia is a chronic medical condition, you should be taking medication long term.
Yes.
Just like diabetes medication or high blood pressure medication, you should take your cholesterol medication long term.
Yeah.
Now, the baseline treatment is a group of drugs called statins. They usually take care of the LDL, the bad cholesterol. Now, there are other modalities of treatment, other newer modalities of treatment that were not there when I was in medical school. For example, a group of drugs called PCSK9 inhibitors. Basically, it's an injection every 2 weeks. An injection every 2 weeks reduces LDL remarkably.
Yes.
There is another group of drugs that reduce the cholesterol. You take one injection every 6 months. And the side effect profile of these newer medication or newer drugs, they are near zero. Now, for statins, in a group of patients, they get muscle pains, or they get insulin resistance or glucose intolerance, but these are minor percentages. The vast majority of people who take statins have no side effects whatsoever.
That's funny that you mentioned it, because I was actually going to ask you about side effects. I think also because of the side effects, as you mentioned, almost to zero,
yes,
near zero, a lot of patients should not worry about taking medications.
Not at all, not at all. And there is a problem. I thought it was in Kuwait, but it turns out it's an international thing. Is that people who are not specialized, people who are not medical personnel, they prescribe statins and they advise to take or not to take statins. You should leave this to specialists.
Definitely.
If it is if it is above your pay grade, if it is outside your specialty, you should not be doing this.
Absolutely. Now, would there be a time, Dr. Badr, that that you would see the patient is doing very well, let's say also with their modifying their lifestyle choices, and the symptoms have gone, have improved?
Which symptoms?
Chest pain, or the cholesterol has gone down, they're doing well with their diabetes, blood sugar, blood test, would you tell the patients to stop? Also,
No.
their high blood pressure.
No,
Because they have that misconception that once all these are treated, I could stop the medication.
Okay, this is not a cure, it's a treatment.
Yes.
So yeah, so if you have high blood pressure, you should be taking blood pressure medication for life. If you have high cholesterol, you should be taking your cholesterol medication for life.
Yes.
If the cholesterol goes down, it means that the medication is working.
Yes.
And that the dose is appropriate. So if you stop the medication, everything will rise up again.
Yes.
As if you, and we are back to square one.
Yes. Now, doctor, what would you tell people that ignore their high cholesterol over many years?
Denial has always been a problem, whether it's cholesterol or hypertension, high blood pressure, or diabetes. If you put your head in the sand, if you pretend everything is going to be fine,
yes,
when the ischemic event hits, when I say ischemic event, I mean stroke, God forbid, or unstable angina, chest pain, heart disease, when they come, treating them as a secondary prevention is a lot harder. So if you refuse to take a 10 milligram of your statin, it will be raised to 80 milligrams of statin once the damage has already been done.
Do you still see patients like that that are in denial?
All the time. Some of them are in denial, others are just stubborn.
Yes.
Just stubborn. Some people say, I just have to take my chances.
Yeah, I see that a lot too. And always they want to just depend on diet or exercise, which is completely not it.
Alternative medicine is a big problem in this part of the world.
Yes.
It's a global thing, but in this part of the world particularly. So a patient who has any chronic medical condition, they are more likely to take their neighbor's advice rather than a medical personnel's advice.
And it's our job to educate and raise their awareness and especially tell them about the side effects that they're less now.
Yes.
Now, Dr. Badr, what would you give the one piece of advice to someone living with high cholesterol?
Take the medication.
Keep taking the medication.
Take the medication.
Yes.
Yeah, period.
Yes. Would you tell them, like, let's say if they have a little bit overweight problems?
Okay, this is another misconception, doctor. High cholesterol has nothing to do with obesity.
Okay, that's interesting.
Yes, because there are people who are very lean, they are very thin, and yet they have high cholesterol.
Absolutely.
So obesity is one thing, cholesterol is something else.
Definitely. So they need to keep an eye, especially those who are lean, because they have that misconception on their cholesterol when it goes high.
Absolutely.
And especially if they have a family history.
Absolutely. Family history is key. Basically, if you have high cholesterol, most likely you inherited it from one of your parents.
Yes, yes. Thank you, Dr. Badr, again, for those valuable information. Now, I see a lot of patients that are in denial with smoking and their smoking habits. Some of them, sometimes they link it with not having high cholesterol, or does it block their arteries along with the cholesterol? Is one linked to the other, the smoking and high cholesterol?
That's a very good, very valid question. Now, have you heard the expression adding insult to injury?
Yeah.
So cholesterol damages the arteries, smoking damages the arteries. Put them together.
Yes.
So it's like adding insult to injury. Now, cholesterol makes the arteries hard. It's called atherosclerosis. Yes. Now, smoking makes the atherosclerosis even worse, because smoking is primarily composed of tar. Yes. And tar deposits on the arteries, and it composes of nicotine. Nicotine raises blood pressure, increases heart rate, and decreasing blood pressure as well as elevating heart rate could cause arteries to become hardened even more.
Yes.
Hardened arteries meaning higher probability of an ischemic event or a thromboembolic event. Yes.
Which means the arteries are not pumping the blood efficiently.
And the blood will have a tendency to clot.
Yes, yes. And what about vapes? People who take smoke vapes?
When it comes to vaping, vaping does not harm the arteries per se, but vaping causes lung inflammation. Which is a separate problem.
Yes.
It doesn't directly hurt the heart, but vapes usually are rich with nicotine. Nicotine raises blood pressure and it accelerates the heart rate.
Yeah.
So it has a minor role in heart damage.
Yeah.
When it comes to cardiac injury, they are not as bad as smoking. So,
but they still need to be careful.
Absolutely.
Definitely.
Absolutely.
Well, thank you, Dr. Badr, again, for your valuable information and knowledge and clinical practice experience you shared with us today.
My pleasure.
We need to have you again. Thank you, Dr. Badr.
Bye.
Well, dear viewers, thank you again for tuning in with Medical Talk. We'll see you right here again next time on our show. Goodbye.